menstrual blood that you shed during your period. If left unchecked, cervical cancer can spread, leading to usually plays a huge role in your Hi everyone! Welcome to another episode of OBGYN On Call. I'm Dr. Issa, and if you're new here, this series is all about shedding light on sexual health, love toys, pleasure, and everything in between. Today's topic is a serious one, but it's something that we all need to be more aware of. According to the World Health Organization, cervical cancer is the fourth most common cancer in women globally. There was approximately 660,000 new cases and 350,000 deaths reported in 2022. In the Philippines, the situation is even more concerning. Cervical cancer ranks as the second most common cancer in females. Every year, around 7,897 females are diagnosed with the disease, and sadly, 4,052 lives are lost to it. That said, this guide will explore everything that you need to know about cervical cancer. But just a quick disclaimer, this video is for educational purposes only. It is not a substitute for a professional diagnosis. Please consult your healthcare provider for further guidance. Let's first examine the cervix. It is a narrow, inch-long passageway located at the lower part of the uterus. To help you visualize where it's located, let's look at the diagram of the female reproductive system. You'll see the ovaries, followed by the fallopian tubes connecting to the uterus. Now, at the very bottom of the uterus, there's this tube that connects it to the vagina. That's the cervix. The cervix primarily consists of four parts. You have the external os, you have the ectocervix, you have the endocervical canal, and you have the internal os. The internal os is the opening between the cervix and the upper part of the uterus. The endocervical canal is the narrow passageway that extends from your internal os to your ectocervix. The ectocervix is the outer part of the cervix that extends slightly into your vagina. Interestingly, you can actually feel this part when you insert your longest finger. It might feel like a small, firm, donut-shaped organ. And lastly, the external os is the opening of the cervix that leads into the vagina. Now, the cervix may be small and narrow, but it actually plays a huge role in your reproductive system. The menstrual blood that you shed during your period actually passes through the cervix before it comes out of the vagina. The cervix acts as a protector or a gatekeeper for your uterus, ensuring that tampons, diaphragms, or other objects do not slip inside. The cervix secretes cervical mucus during the ovulation phase of your menstrual cycle, which is usually thinner and less acidic than usual. This change makes it easier for the sperm to travel to the uterus. This thin cervical mucus also helps the female partner pinpoint their most fertile days, which is valuable for those who are trying to conceive. During unprotected vaginal sex, sperm is ejaculated into the vagina. The sperm then moves through the cervix, into the uterus, and into the fallopian tubes where it may fertilize an egg. During pregnancy, the cervix also produces a mucus plug that seals off the uterus to protect it. When it's time for delivery, the mucus plug dissolves, the cervix dilates, allowing the baby to pass through and exit the uterus. Now that we've covered the basics of what the cervix is, let's now shift our focus to cervical cancer. Cervical cancer is a type of cancer that develops in the cells of the cervix. Before cervical cancer develops, the cells in the cervix usually go through a series of changes known as dysplasia. This is when abnormal cells start to appear in the cervical tissue. If these abnormal cells are not treated or removed, then they may progress to cancer. There's also the potential for these cells to spread to other areas. Here are some of the common types of cervical cancers that you may encounter. Squamous cell carcinoma. This is the type of cervical cancer that develops from the squamous cells of the ectocervix. About 90% of cervical cancer cases are of this type. The next is adenocarcinoma. They develop from the columnar-shaped glands of the endocervical canal. Mixed carcinoma or adenosquamous carcinoma. This type can feature both adenocarcinoma or squamous cell carcinoma. However, this type is incredibly rare. Other types of cancers can also develop on the cervix, but they are very rare. In the early stages, cervical cancer often doesn't show any symptoms. However, some people may experience the following signs: vaginal bleeding during sex, or after menopause, prolonged and heavier periods, vaginal bleeding or spotting in between menses, pelvic pain or pain during sex, unusual vaginal discharge that may be watery, bloody, or have a strong odor. If you're experiencing any of these symptoms, then it's important to see a healthcare provider as soon as possible. While having these symptoms doesn't automatically mean that you have cervical cancer, it can be a signal that something is not right. And if it is cancer, then catching it early can give you the best chance at a successful treatment. If left unchecked, cervical cancer can spread, leading to more serious symptoms like profuse vaginal bleeding, abdominal or back pain, fatigue, sudden weight loss or lack of appetite, swelling in the legs and feet, painful urination, painful bowel movements, or having difficulty defecating, possible bleeding from the rectum. As I mentioned, if you see any of these signs, don't wait, please see a doctor as soon as possible. The earlier that you get checked, the better your chances of catching any issues early on and taking action. Let's move on to what causes cervical cancer. The primary cause of this disease is a long-lasting and persistent infection from HPV or the human papilloma virus. The primary cause of this disease is a long-lasting and persistent infection with high-risk types of HPV or the human papilloma virus, especially types 16 and 18. These two strains are responsible for a majority of the cases of cervical cancer. HPV or the human papilloma virus is a very common virus that affects different parts of your body. Most people who are sexually active can get it at some point in their lives. There are over 100 types of HPV, and some of them may even cause warts on your hands, feet, or face. Most of them are not harmful and they usually go away on its own. However, about 12 of them are considered high-risk types and can lead to serious conditions like cervical cancer. There are also risk factors that can increase the risk of someone with a high-risk HPV infection in the cervix to develop cervical cancer. Here are some of them. Becoming sexually active at a young age. The earlier you start having sex, the higher the likelihood that you will be exposed to HPV. HPV doesn't show symptoms right away, so you can have the virus without even knowing it. That's why regular screening with a pap smear test or the HPV test is so important even if you're not experiencing any symptoms. Having multiple sexual partners or being with someone who has had multiple sexual partners in the past. More sexual partners means more exposure to different types of HPV. And even if you've only been with one partner, if they've had multiple sexual partners before, or if they're still seeing other people while you're in a relationship with you, then the risk is still there. That's why it's crucial to have open conversations about sexual history and consider getting tested together before becoming intimate. Having a weakened immune system. When the immune system is not functioning at full strength, then the body may struggle to clear the virus. This will result in a persistent viral infection that may lead to changes in the cells of the cervix, leading to cervical cancer. A weakened immune system may be caused by conditions like HIV or taking medications that suppresses the immune response. For example, treatment used to prevent organ rejection after a transplant, medications for autoimmune diseases, or medications that treat cancer can lower immunity. Smoking. According to cancer.org, females who smoke are twice as likely to get cervical cancer compared to non-smokers. Research has even found tobacco byproducts in the cervical mucus of females who smoke. This suggests that these substances can damage the DNA of the cervical cells, leading to the development of cervical cancer. Smoking also weakens the immune system, making it less effective at fighting off HPV infections. Secondhand smoke can also pose a risk. Inhaling smoke exhaled by others increases the chances of developing cervical cancer. Early age pregnancy and multiple full-term pregnancies. Certain pregnancy-related factors can increase your risk for cervical cancer. For example, females who have their first full-term pregnancy before the age of 20 are at a higher risk for developing cervical cancer later in life compared to those who had their first full-term pregnancy at the age of 25 years old or older. Having more children is also related to a higher risk of cervical cancer. No exact number of births directly correlate to a significant increase in that risk. Studies suggest that these pregnancy-related factors are due to the cervical trauma that occurs during childbirth. Also, women who give birth younger are usually also younger when they first engage in sexual activity, making them more exposed to HPV. It is recommended by the Philippine Obstetrical and Gynecological Society to get screened starting at the age of 30 years old through 65 years old. Here are the 2 common screening tests that you can try. Pap smear. This test involves a medical professional collecting cells from your cervix. The cells are then sent to a lab for a pathologist to read to check for abnormalities. This test is done every 3 years starting at the age of 30 years old here in the Philippines. HPV DNA test. This test is similar to the pap smear test where the doctor will collect cells from your cervix as well. However, the difference is that in the laboratory, it will be specifically checked for any HPV types that may be persistent in those cells. If there are any high-risk types detected, then other tests will follow. Once a doctor sees that the report says that you might have cancer, then other procedures will follow. A referral to a special OBGYN called a gynecologic oncologist may be done. Colposcopy. A colposcopy is a more detailed examination of the cervix following an abnormal pap smear or HPV test. A microscope called the colposcope will be used to magnify the cells of your cervix around 8 to 15 times to see if there are any other abnormal cells. If any abnormal cells will be seen during this examination, then a biopsy may be done. Biopsy. If your doctor sees any unusual cells in the cervical tissue, then they may take a tissue sample and send it to the pathologist for further examination. Once your doctor confirms the presence of cancer, they will confirm the stage of your cancer, and usually this is done clinically. They will also conduct additional tests like the following. Blood tests like a complete blood count. These can help assess your overall health, so this could be a complete blood count, platelet count, liver enzymes, those kinds of blood tests. Chest X-ray. It is used to examine the lungs to determine if there is any spread of cancer in the lungs. A CT scan. A computed tomography scan may be done especially in the pelvic area to see the spread of the disease in that area. Depending on your symptoms and findings from other tests, your doctor may recommend other tests to be done as well. An MRI or PET scan may be recommended by your doctor to see the extent of the disease as well. After all the necessary tests are done, then your doctor will now create a personalized treatment plan for you. This depends on the stage and the extent of the cancer. Treatment options may vary depending on the extent of the disease and how far the disease has spread. If the cancer is localized on the surface of your cervix, then your gyne-onco doctor may suggest procedures to remove the cervical cells that are affected. Procedures like the LEEP or the cold knife conization may be suggested. These procedures are effective in treating early-stage cervical cancer. If the cancer has spread beyond the surface of the cervix or it has reached a certain size or stage, then a hysterectomy may be suggested. A hysterectomy often involves removing the uterus, the fallopian tubes, and sometimes the ovaries. If the cancer has spread to the uterus, to the parametria, or even to the vagina, then a surgery is not possible. Only radiation therapy or chemotherapy may be done at this time. While undergoing treatment for cervical cancer, certain lifestyle changes can make you stronger. This includes quitting smoking and drinking alcohol, as these can weaken your immune system. These can also interfere with your medications. You should also get enough rest and consume a well-balanced diet. Engaging in physical activity to keep your muscles strong is also very important during this trying time. Lastly, managing stress through relaxation and spending time with your loved ones through this difficult time is also very important. But as the saying goes, prevention is better than cure. Let's not forget that cervical cancer is preventable. It is one of 2 cancers that we can actually prevent. The development of cervical cancer is very gradual, and it gives you time to catch it at a very early stage, even before it becomes cancer. Here are some tips to significantly reduce your risk. Get regular pelvic exams and screening tests. Adding these tests to your health routine can help you detect cell changes before they even become cancer. Here's a general screening guideline from the Philippine Obstetrical and Gynecological Society. From ages 30 to 65 years old, do a pap smear test every 3 years or a high-risk HPV test every 5 years. For sexually active individuals who are at a high risk for STDs, then test annually for the following: chlamydia, gonorrhea, syphilis, and HIV. After age 65 years old, you may stop screening if you've had a previous test that is normal, if you've had your cervix removed, or if your doctor deems you low risk. Getting vaccinated against HPV is one of the ways that you can prevent cervical cancer. HPV is the leading cause of cervical cancer, and completing the doses provides you with long-term immunity. There are two types of HPV vaccines. The first is a quadrivalent vaccine, which protects you from 4 types of HPV viruses. This is HPV 6, 11, 16, and 18. So HPV 6 and 11 causes genital warts, while HPV 16 and 18 causes cervical cancer. Meanwhile, the non-valent vaccine protects you from 9 HPV strains. It protects you from the 4 strains that I mentioned earlier, so that's 6, 11, 16, and 18, plus 5 more, HPV types 31, 33, 45, 52, and 58. The HPV vaccine is recommended starting at age 9 years old for both males and females. This is the ideal time to get the HPV vaccine, so ideally before you become sexually active. Getting vaccinated before exposure to HPV ensures a stronger immune response. For those who are 9 to 14 years old, you only need 2 doses, and for 15 years old and above, you need 3 doses. For those who have multiple sexual partners and who are probably exposed to HPV, who are 27 years old to 45 years old as well, you may still get the vaccine, as this can still prevent reinfections and provide some benefit. However, you just have to know that it won't cure existing HPV infections. While the vaccine is more effective when taken earlier, it's never too late to protect yourself from potential new infections. Lead a healthier lifestyle. Your immune system plays a crucial role in preventing HPV infections that will lead to cervical cancer. A stronger immune system is better equipped to fight off HPV infections. To support your immune health, quit smoking, quit drinking alcohol, and other things that can harm your body. Adopting a healthy lifestyle is equally important as well. Focus on eating nutritious meals, staying active with regular exercise, and ensure you get enough rest. Follow safe sex practices. HPV is primarily spread through intimate skin-to-skin contact or sexual contact, so practicing safe sex is crucial. Using condoms can significantly decrease your risk of contracting sexually transmitted infections and even HPV. While no method offers 100% protection, condoms are the only contraceptives that can guard against STIs. It might also be in your best interest to limit the number of your sexual partners, as more partners means more exposure to HPV. And that ends our episode. I hope that this has given you a clear understanding of how this disease develops and how you can prevent it. Remember, as I mentioned earlier, prevention is better than cure. And cervical cancer is one of 2 cancers that is preventable. If you haven't already, please consider getting the HPV vaccine and doing the cervical cancer screening tests like pap smear or HPV testing if you haven't done them yet. Now, for those who have never visited a gynecologist before, don't worry, we have a previous episode where I walk you through what to expect your first visit with a gynecologist to make the experience easier for you. Please like and subscribe to the channel if you found this guide helpful. Once again, I'm Dr. Issa. Thank you for watching and take care!